We often collapse into bed at the end of a long day, believing that once our eyes close, our body simply powers down into a harmless state of rest. We think the position we choose, whether we curl into a ball, stretch out like a starfish, or lie flat on our backs, is merely a matter of comfort or habit. But I am here to tell you that the way you lie down could be silently waging a war on your heart, specifically if you are one of the millions of people who sleep flat on your back. While this position, known medically as the supine position, is often touted as being good for spinal alignment, it creates a perfect storm for cardiovascular disaster when it comes to your breathing and heart health. The core of the problem lies in gravity and the basic anatomy of your throat. When you lie flat on your back, the tissues in your mouth and throat, including your tongue, soft palate, and uvula, naturally collapse backward due to gravity. For many of us, this doesn't just cause snoring. It leads to a partial or complete blockage of the airway. You might still be breathing, but you are struggling for every breath. This struggle isn't just a noise nuisance for your partner, it is a severe physiological stressor. When the airway becomes obstructed, your intake of oxygen is restricted. This forces your body into a state of silent panic where your oxygen levels can dip dangerously low while carbon dioxide builds up in your blood. This is the precursor to obstructive sleep apnea, a condition that acts as a multiplier for heart attack risk. When you are in that deep, flat sleep and your airway narrows, your chest muscles may work harder to try to open the airway, putting immense pressure on your chest wall. You may not even realize it is happening, but your body is essentially being suffocated repeatedly throughout the night. This mechanical obstruction sets off a dangerous chain reaction. As the airway collapses, the pressure in your chest changes dramatically, affecting the return of blood to the heart and forcing the heart to pump against increased resistance. It is crucial to understand that sleeping this way turns your restorative rest into an endurance test for your cardiovascular system. The back position essentially removes the natural protective mechanisms that keep your airway open when you are upright or even on your side. By choosing to sleep flat on your back, you are inviting gravitational forces to compromise your breathing, and that compromise is the first domino to fall in a sequence that ends with serious heart strain. If you wake up feeling unrefreshed despite a full night's sleep, or if you have been told you snore heavily, your sleeping position is likely the primary antagonist, turning your bed into a place of risk rather than rest. But let's look closer at exactly what happens inside your body the moment that airway begins to narrow while you are lying flat. It is not just a momentary pause in breathing. It is a violent physiological shock to your system. When your airway collapses and oxygen intake is cut off, your blood oxygen levels, your saturation begin to plummet rapidly. This condition, known as hypoxia, is terrifying for your brain and vital organs. Your body instantly detects that it is suffocating, and in response, it triggers a massive emergency response to force you to breathe and to keep blood flowing to your brain. To compensate for the lack of oxygen, your heart kicks into overdrive. Imagine trying to run a marathon while breathing through a tiny straw. That is essentially what your heart is experiencing. It begins to beat faster and more forcefully, trying to circulate the limited oxygen available to your brain and other vital tissues. This sudden spike in heart rate happens while you are completely unconscious, meaning you have no control over it. Simultaneously, your blood pressure skyrockets. The blood vessels constrict to redirect blood flow, creating a massive surge of pressure against your arterial walls. This is not the gentle rise and fall of a resting cardiovascular system. It is a violent, repetitive spike that occurs dozens, sometimes hundreds of times a night. This repetitive strain creates a dangerous environment for a cardiac event. The heart is a muscle, and like any muscle, it needs rest to recover. But when you sleep in a position that obstructs your breathing, you are denying the heart that recovery period. Instead, you are forcing it to perform high-intensity interval training in the middle of the night. The sheer force of the blood pumping against stiffened vessels can destabilize plaque buildup in the arteries. If a piece of that plaque ruptures because of this sudden pressure spike, it can form a clot instantly, blocking blood flow to the heart muscle itself. That blockage is the direct cause of a heart attack. You are literally creating the mechanical conditions for a heart attack with every breath you struggle to take. This isn't just about poor sleep quality, it is about the immediate physical trauma inflicted on your heart with every episode of obstruction. So, we have established that your heart is straining physically against the lack of oxygen and the pressure in your chest. But the danger goes even deeper than the mechanics of the heart muscle itself. We have to look at the master control center, your nervous system. This is where the true domino effect begins to tumble out of control. When your airway collapses and your body screams for air, your brain is forced to make a life or death decision. It detects the suffocation and triggers a survival mechanism known as a microarousal. You probably won't remember this happening. You won't sit up in bed and gasp necessarily, but your brain will drag you from deep, restorative sleep into a lighter state of wakefulness just to jolt your airway open. This is not a gentle nudge. It is a full-blown alarm system going off in your body. This sudden, repeated activation engages your sympathetic nervous system, the fight or flight response. Biologically, your body cannot distinguish between suffocating in your sleep and being chased by a predator on the savanna. It reacts with the same intensity. This is where the cascade becomes truly dangerous. Each time these microarousals occur, your body floods your bloodstream with stress hormones like adrenaline and cortisol. These hormones are evolutionary tools designed to give you burst energy and focus in an emergency, but releasing them repeatedly while you are supposed to be resting is catastrophic. They force your heart to beat erratically and keep your blood vessels constricted and tight. Under normal, healthy circumstances, your blood pressure should dip at night, giving your cardiovascular system a much-needed break. But because of this sleep position, your nervous system keeps you in a state of hyper-vigilance. You are effectively stuck in a feedback loop of stress. You sleep, you choke, your brain panics, hormones spike, and then you drift off only to do it all again minutes later. This chronic stimulation prevents your body from entering the rest and digest mode required for cellular repair. Your heart remains under constant assault from these chemical messengers, keeping your blood pressure elevated even when the airway is open. The domino effect is relentless. One bad position leads to airway blockage, which triggers a nervous system storm, which keeps your blood pressure dangerously high throughout the night. This relentless, silent stress is essentially torturing your cardiovascular system, turning your sleep into a chemical battlefield. So, if sleeping on your back is the enemy, the natural instinct is to roll over to your side, and you are absolutely right to do so. Sleeping is generally far superior for keeping that airway open and preventing the collapse we just discussed. However, before you get too comfortable, I need you to understand that your body is not perfectly symmetrical, and the side you choose actually matters significantly when it comes to cardiac health. There is a distinct anatomical difference between the left and the right side, and understanding this trade-off is crucial for maximizing your heart's protection. Let's look at the clear winner, the left side. When you lie on your left, you are essentially positioning your body in a way that works with, rather than against, your circulatory system. Your heart sits slightly to the left of your chest, and the largest artery in your body, the aorta, arches over the top of the heart, and curves down to the left. By sleeping on your left side, you allow gravity to assist the heart in pumping blood downward through that aorta. It reduces the effort required for each heartbeat. Furthermore, the inferior vena cava, the massive vein responsible for carrying deoxygenated blood back to your heart, runs along the right side of your spine. When you sleep on your left, you keep this vein unobstructed, allowing blood to flow freely back to the heart without restriction. Now, contrast that with the right side. While sleeping on your right is still infinitely better than lying on your back, it introduces some anatomical compromises that we want to avoid if possible. Because the vena cava is on the right, lying directly on it can compress the vein, particularly if you are a bit heavier or have a larger midsection. This compression restricts the volume of blood returning to the heart, forcing the heart to work harder and beat faster to maintain blood pressure. Additionally, the stomach and the liver are positioned in such a way that lying on the right side can encourage acid reflux. This isn't just about heartburn. That acid can rise into the esophagus and cause spasms or pain that can easily be mistaken for heart palpitations or cardiac distress, especially in the dark of night. Essentially, sleeping on the right side creates subtle bottlenecks in your body's plumbing. It increases the mechanical workload on the heart and leaves you vulnerable to digestive issues that mimic heart problems. The left side, however, clears the path. It optimizes hemodynamics and lymphatic drainage, which naturally filters toward the left. It is the position of least resistance for your cardiovascular system, and that is exactly what we want when we are trying to lower the risk of a heart attack during sleep. It is a simple shift in gravity, but it makes a profound difference in how hard your heart has to work to keep you alive. We have discussed the mechanics of how you sleep, but now I want to turn your attention inward and ask you a simple yet critical question. How do you actually feel when you wake up? Many of us have become so accustomed to feeling exhausted that we mistake daily fatigue for a normal part of life, but it is often the body's way of signaling that something is wrong. If you are sleeping in a position that compromises your heart, your body will leave you distinct breadcrumbs, red flags that you simply cannot afford to ignore. These are the silent warnings that your heart is under duress every night. The most obvious and immediate sign is chronic, unexplained daytime fatigue. It goes beyond just feeling a bit groggy. It is a pervasive, heavy exhaustion that coffee cannot fix. This happens because even if you are unconscious for 8 hours, you are not getting the deep, restorative sleep your brain and heart need to repair themselves. Instead, your brain is constantly jolted out of deep sleep by those micro-arousals we discussed, leaving you feeling like you ran a marathon in your sleep. But the signs go deeper than just tiredness. If you frequently wake up with a dull, throbbing headache or a sore throat, that is a direct result of low oxygen levels. Your brain is literally gasping for air all night, causing the blood vessels in your head to expand, leading to that morning pain that lingers long after you have gotten out of bed. Perhaps even more alarming are the symptoms that mimic other conditions. If you wake up suddenly in the middle of the night with a racing heart, a sense of impending doom, or sweating profusely, do not dismiss this as just a bad dream or anxiety. These are often panic responses triggered by your nervous system as it fights to open your airway. Your body is shooting you with adrenaline because it thinks it is suffocating. You might also experience chest tightness or palpitations immediately upon waking. This is your heart reacting to the surge in blood pressure and the strain of pumping against a blocked airway. It is vital that you tune into these messages. Do not dismiss waking up gasping for air as minor snoring, and do not ignore the persistent brain fog that follows you through the day. These are not inconveniences. They are the physiological distress signals of a heart that is struggling to keep up. If your partner tells you that you stop breathing, or if you notice that your energy levels have plummeted despite getting enough sleep, your body is begging you to change your position. Listen to it, because these symptoms are the early warning system for a much larger cardiac event. Now that we have uncovered the hidden dangers, identified the warning signs, and understood why the left side is the superior position, the question becomes, what do we actually do about it? I know that simply telling you to stop sleeping on your back is easier said than done. You cannot consciously control your body position when you are unconscious, and habits formed over a lifetime are difficult to break. However, you are not helpless in this fight. You can employ specific physical tools and environmental changes to force your body into a safer posture, effectively training yourself to sleep in a way that protects your heart. The most effective and immediate tool you can introduce tonight is a body pillow. It sounds simple, but the mechanics are crucial. I want you to take a long, firm body pillow and place it parallel to your spine, but specifically behind your back. This acts as a physical barrier or a bumper. If you are lying on your left side, the optimal position for your heart, and your body attempts to roll backward onto that dangerous supine position during the night, the pillow will stop you. It provides a tactile reminder that keeps you anchored on your side, ensuring your airway remains open and your heart stays relaxed. For those who find side sleeping difficult due to shoulder pain or other issues, we can use gravity to our advantage by elevating the head of the bed. Note that I am not talking about piling up 3 fluffy pillows under your head, which can often kink your neck and worsen the airway obstruction. Instead, you want to elevate the entire upper torso. You can achieve this by using a foam wedge or by raising the head of your adjustable bed frame by about 6 inches. This slight incline helps prevent the tongue and soft palate from collapsing backward, keeping the airway clear without forcing you into a position that causes you pain. Finally, we have modern technology on our side in the form of positional therapy. There are now specialized devices, small sensors that you can wear on your chest or place under your mattress. These smart devices monitor your orientation throughout the night. The moment they detect that you have rolled onto your back and stayed there for a dangerous length of time, they emit a gentle vibration. It isn't strong enough to wake you up fully, but it is enough to trigger a subconscious shift, prompting you to roll back onto your side. Over time, this creates a neurological feedback loop, conditioning your body to avoid the back position entirely. These are not merely sleep accessories. They are life-saving interventions that put you back in control of your cardiac health every single night.